Many of you may have known the late Dr. Laurance Nickey from El Paso, who passed away in August of 2018. Dr. Nickey was a pediatrician and a longtime director of the El Paso City-County Health District. He was a dedicated border health advocate, helping to create the U.S.-Mexico Border Health Commission. He made exceptional contributions to public health in Texas, was a brilliant physician leader, very active in TMA, and served as a mentor to all of us. We'd like to present a short video commemorating Dr. Nickey, giving you a glimpse of just how much he meant to us and what he did for Texas.
If Texas ever had a father of public health, Dr. Laurance Nickey might be worthy of that title. An El Paso pediatrician, Dr. Nickey became renowned for his contributions to improve public health in the border city. He fought polio and tuberculosis and sought safe food and clean water and air for his community. His work led to the creation of the United States-Mexico Border Health Commission, and he rallied physicians and other healthcare workers to battle disease and led and mentored other physicians in organizations like TMA.
Dr. Nickey exemplifies the mission of TMA to improve the health of all Texans, and actually figured out that in order to improve the health of all Texans, he and all of us had to think outside the walls, the borders, the lines of the state of Texas.
There's no magical line in the Rio Grande River that says air pollution, you either stay north or stay south, and you don't keep measles on the south side or you don't keep chickenpox on the north side. It doesn't work that way. What happens in one city happens in the other city almost immediately.
He was a great clinician, taking care of the people and kids of El Paso. But he looked beyond the walls of his clinical practice to figure out how he could improve the overall health of his community with vaccinations and insurance, and address the really tough problems of the border that we have here in the state of Texas. And I think that's a great role model for us as physicians, to take care of our patients, but look broader at how do we improve our society.
In recognition of the many great contributions Dr. Nickey made to public health, the TMA Council on Science and Public Health is honored to recognize other physician leaders who have also made outstanding contributions to public health in Texas.
So the Council on Science and Public Health created an award this year to honor Dr. Nickey and his legacy. The Laurance N. Nickey Lifetime Achievement Award recognizes a TMA member physician who has made outstanding contributions to medicine through a significant commitment to public health. And I have the honor today to announce and present to you the inaugural recipient of this prestigious award. The recipient of this award, like the late Dr. Nickey, has exhibited an impressive commitment to his community and leadership within TMA, as well as his county medical society. He is a clean air advocate, sought to reduce ozone-causing emissions from coal-fired power plants in Texas, and established TMA's air pollution control policies. He has mentored countless young physicians and public health professionals. He is known for his courage and his persistence in tackling difficult public health challenges. And his many public health achievements include clarifying the causes and pathophysiology of Gulf War illness and designing the Dallas Heart Study. The Council on Science and Public Health is proud to recognize the remarkable career and leadership of this year's recipient, Dr. Robert Haley. Thank you, Dr. Haley, for all that you've done for medicine and for public health, for TMA, Texas, and beyond.
Thank you, Wendy. Let me just say one thing about Larry Nickey. I've known Larry Nickey for many years, and as a result, this honor is really two honors for me. First of all, it's certainly welcome and wonderful to be recognized by your peers, particularly the peers that made most of what I have done happen, particularly on the clean air and closing a couple of the dirtiest coal-fired power plants soiling the Dallas-Fort Worth air. TMA and Dallas County Medical Society played a key role in making that happen, and without them it wouldn't have happened. And you know, that's the same with Larry Nickey. Larry accomplished some amazing things. He immunized the whole city of El Paso and the surrounds for polio back in the 60s when it wasn't happening. He pretty much eradicated tuberculosis from the area. And then he recognized border health and basically brought a major solution to that problem that's being implemented still. But the question is, how did he do it? And that's important for us to recognize. Larry was a visionary. He saw the need to address border health. And what he did, he worked through his local medical society in El Paso. It turns out at that time he was chair of the Council on Science and Public Health. He introduced that in the council, took that to the TMA level, marshaled the evidence, a ton of evidence of why that was a problem and what could be done about it, sold that to TMA, and then TMA used this multiplier effect to make it happen, all the way to creating a number of large multidisciplinary conferences to discuss border health, bringing in more adherents, all the way to a binational agreement between the governments of the United States and Mexico. That was done by the vision of Larry Nickey, but through the leveraging and power of TMA. And so we got to realize what power we have and how we can use it to the betterment of our patients and the citizens of Texas and the United States and the world in this case.